Well, while we're waiting, I'll fill in. So I'm Jeff Deedrick. I'm the captain for LA County Sheriff's Department, and I have the most unique command on the department. It's called Community Partnerships Bureau, and I oversee about 11 different subject matter things. But the two that I'm here today representing is our mental evaluation team and our homeless outreach services team, which are both co-response teams, which pair a specially trained deputy sheriff with someone in the MET team. It's a licensed clinician from DMH. On the host side, it's a civilian homeless outreach worker from LASD. So what is our mission of MET? And this is our core mission, is to provide compassionate, respectful, effective crisis response. And it's all based on building trust and rapport within the communities we serve. That is our core mission, and we will not deviate from it. We're one of the only agencies in the country that have our own mental health triage dispatch desk. So 24 hours a day, law enforcement in LA County, and actually throughout the state, they call us too, as a couple of my deputies back there will attest to, call into our desk, and it's in South El Monte, and then we dispatch our MET teams from there. Looking at the numbers, look at 2021 was 8,000, 2020 was a little lower, but since the pandemic, as Steve and others have mentioned, the numbers are exploded. I think we're around 13,000 right now projected for 2024. And so the increase on our staff has been immense, but you can see that having this specialized resource allows for us to effectively do what we do when you see the next numbers. We have 34 teams for the entire county of Los Angeles. Currently, the Board of Supervisors, the Sheriff, the Office of Inspector General, everyone have agreed that we should be at the minimum of 60, and we're at 34, which is better than 0, but 34 is stressing it, as each of you know the challenges you're having with your workforce. And I know you said exfoliating and different things. We were in a meeting yesterday and talking about coming out of the pandemic, and I was with DMH leadership, and we're all talking about how can we get our resources and how can we do this and how can we do that. And one of my folks said, we just need to survive. And I said, stop that mindset right now. That's why we're messing up. We don't need to survive, we need to thrive. And so we're changing that. We're done with the pandemic. It's time to thrive, go forward, enhance our collaborations, and look at strategies to get us there in a positive way. We treasure our relationship with DMH. If it wasn't for that, there would be no MET team. Because the clinicians, how they interact with the deputies, they teach us. Our deputies don't know it, but they're in school every day in that car with the clinician. And they need to be, because if you look, we are the only one for LA County. The fire department uses us, CHP uses us, the state, the feds, Secret Service, you name it, they call LA County Sheriff's MET for any kind of crisis response where someone's presenting in crisis or they have a projected incident that may happen where they need somebody to do that. We also have a team that's specific for our community colleges, and the city of West Hollywood is contracted for their own MET teams. The rest of our bureau is actually divided regionally, but when it comes to West Hollywood and community colleges, they have their own. We also are a CNT team. So when you see the barricade and someone in their car on the freeway and the police cars are there all night, our MET specially trained deputies in crisis negotiation, along with other cadre of personnel, they're the ones that go there. One of the special things that we do have is called our VMET team. And our VMET team, especially here in Los Angeles County, where we have the largest amount of homeless veterans in the country, and understanding that we needed to have a special response to that. Because, and as we'll talk about when we get into some of our training, cultural competency, right? And different things, and understanding how to connect with someone. Because when I get to our training, and then you'll see my passion will just grow, and grow, is our rapport building model that we can contribute success, and I'm getting ahead of myself, but I'm just too excited not to, is based on rapport building and where it can do for you. We have 5 deputies and 1 sergeant. They work hand in hand 24/7 with the VA. And I'm going to give you an example of where this partnership not only saves lives, it saves time and money. Recently, you might have seen a bank robbery, and I might even mess up the city. I think it was West Hollywood. There was a bank robbery where it was all in the news. There was a man inside the building, held the employees hostage, and it wasn't going well. It had been going on for about 6 hours. Somehow somebody got information that the person inside was a veteran. One of the deputies who had been through our training class, who was on scene, called one of the VMET deputies and said, "Hey, you said if we ever had a veteran to call you. We're here on a SWAT standoff in West Hollywood." And she's like, "Oh, hold on a second. That's a little different than crisis response." Here's what happened. She found out the gentleman's name who was inside the building, called her connection at the VA. The VA then checked the database and said, he will respond to orders from his wife. She, our MET deputy, called his wife and said, "I need you to meet me out front of the bank at the command post." The wife got on the phone and it ended in 5 minutes. So is collaboration important? Is information sharing important? And so what that showed us, and that was a pretty significant one, because actually they had been there 7.5 hours when she made that phone call. And it was over in 5 minutes. And so we're doing a little case study on that one. But what also happens too is the good things that the VA does, and the intense case management and having the wraparound services. So helping the men and women that served our country really be connected. And who's out there every day? It's the deputies, and they're out there, so they don't have any limitations. It's just go find the vets. Go proactively find those men and women and connect them. And so we're seeing tremendous results there. And that only happened because of the support of the board and the sheriff, because this was a separate team that took resources in a different way. You might have to start this one. This says it better than I can.
Here on the streets with the VMET Veteran Mental Evaluation Team. They go out on the streets seeking out veterans to provide them services and even to help them get off the streets. And the two gentlemen you see right here, they are not only LA County Sheriff deputies, but they're also Marine Corps veterans, and they're talking to a Marine Corps veteran who has been homeless for upwards of 3 years.
These are Marines, so a Marine never leaves another Marine behind.
You do want to get off the street?
Yes, of course.
Statistics compiled by the VA show currently there are 67,495 homeless veterans. Veterans comprise 10.6% of all homeless in the U.S. and are 2 times as likely to become homeless versus those who didn't serve in the military.
Saddens my heart.
The LA County Sheriff's Department starting the 5-member VMET team a few years ago. Part of the team is staffed by deputies who are also veterans. All of them on a mission to provide resources and housing for America's homeless heroes countywide. The team understanding that sometimes a veteran can reach a fellow veteran and help more quickly, especially when someone is suffering from PTSD or drug addiction.
Deputy Morell and I served in the United States Marine Corps, so we have that connection that once we explain to them and ask them certain questions that gives them reason to believe us, we're able to connect with them and start making a good conversation to get them to that resource that they need.
My son is in the service and is on a ship, on an aircraft carrier, and is away for long periods of time where I don't get to see him or talk to him, and he's my baby.
LA County Sheriff Deputy Alexis Padilla is a member of VMET.
It's important for them to come home to a support system, and I think it's frustrating when they feel a disconnect because they don't think anybody else understands what they've experienced or what they're going through.
I oversee the Homeless Outreach Services team.
One of the many county-run outreach teams working hand in hand with VMET.
Being a Marine Corps veteran myself, I'll do anything to make sure I get a veteran to a better place. If they can't walk, I'll carry them.
Thanks to his fellow veterans, Larson will get the help he needs, including a care package.
This is an organization, it's called Soldiers Angels, and what they do is they provide these care packages for the vets. You know, it has some snacks, water, protein, in order for them to just get by, you know, if they don't have any food.
Leo Stallworth, ABC 7 Eyewitness News.
And that shows what you can do one person at a time. And it's based on our rapport building model. And you can go to the next one. Is our training. We are very blessed. We, I think, was it August of 2023, Sheriff Luna did the ribbon cutting on the first ever Los Angeles County Regional Mental Health Training Facility, and I run it. It's ours. So deputies that are in the back from our training unit, we can control, we don't have to ask for a venue anymore. We used to have to beg, borrow, and some of you know how that feels, right? To put on an event. We no longer have to do that. We have our own. We've already hosted over 10 states and 3 different countries coming here to get our training. And here's where, and it's important, and I'll be careful. Oh, geez, I gotta hurry. Because in the past, we were blessed with a multidisciplinary approach where 2 psychologists that had over 50 years of street experience working with law enforcement, they came to this mental evaluation team. And what they created was a roadmap to field response that was based in rapport building and recognizing windows of opportunity. So let me give you an example. Because they identified a gap that we found, and the hardest thing to tell a cop is you're wrong. So everyone, if you could, just inhale deeply. And then exhale deeply. What do we call that? Breathing. So why do we call a response where you have high intensity, low intensity, the ability to escalate and de-escalate, why do we only call that de-escalation? We feel that the training they've developed identified a traditional gap in de-escalation that had never been uncovered. And so what we do is we call it crisis stabilization. What we say is you need to minimize escalation, maximize de-escalation, and the whole thing is crisis stabilization. And I gotta hurry. We still gotta do the video because it's for DMH. At the end of the day, I'm very proud to be here. I'm very thankful that you invited us. Obviously on the panel, I can answer questions. We'd like to show you, because one of the things on this was unveiling the impacts of a co-response model. How does your workforce and how does a co-response model affect your workforce? We're gonna play this. It's only 2 minutes, so I'll only go over 2. And when I saw this, I saw the positive and the smiles on the clinicians, and I think it's worth it to share because it told the story without even listening to their words. 2 minutes, that's probably a record for me.
The MET team is a group of deputies paired up with DMH clinicians, and we respond to calls for service dispatched by the Sheriff Department to help people that are in mental health crisis.
These teams are responding as a co-response model, which means that we have kind of the yin and the yang, the best of both worlds that are going to be responding to crisis calls in the field.
Everyone here on this team is here for the same reasons. Everyone really wants to help people. That's everyone's goal here.
Annually, there are about 10,000 calls for LA Sheriff's Department, and 6,000 of those are calls involving MET.
Some days I'm responding and we're handling something in a couple of hours and it's on to the next thing. Some days we're at a scene and it's taking hours because the situation is that critical.
So the kinds of folks who are going to be a really good match for our teams are those who are looking for something that's really dynamic and where they can get back to the community.
You can have such a big impact in people's lives out in the community. It's such a great opportunity to come over to this team and to work this job.
We're looking for folks who are licensed LMFTs, licensed LCSWs, RNs, and also some psychologists.
I would absolutely recommend people who are thinking of applying even to reach out to the clinicians on the team, ask about doing a ride-along with us so you can see it for yourself firsthand, so you can get an idea of, hey, is this what I want to do?
It's really interesting. Again, it's everything's different. It's never the same thing every day. You're not going to be stuck at the desk, doing documentation all day long.
The role of the MET team is really to support folks in the community. It's not about taking anyone to jail or anything like that. It's about getting folks the help that they need.
This is probably one of the safer environments I've been in, which, on the surface, you'd think it'd be the opposite. But our partners take our safety very seriously.
There's a lot of things I love about my job. I know it sounds a little bit cheesy or cliche, but I love it. I really, really enjoy it.